The nasopalatine nerve block is indicated for pain management of palatal soft tissue in the anterior one-third of the palate, approximately from canine to canine. A key landmark is the incisive papilla. The clinician should observe the widest portion and identify the lateral side facing the clinician's handedness. If a clinician determines to use a two-step process for this technique, you could choose pressure anesthesia. Note in the video the clinician is holding the cotton tip applicator very close to the head and applying pressure from one side, still allowing access from the other side for needle penetration. Slow deposit is key for this injection, as all other palatal injections, due to the tightness of the tissue. The clinician will first dry the area and apply topical anesthetic for 1 minute. Then, if using a cotton tip applicator, apply pressure for 1 minute. Continue applying pressure until initial needle penetration and initial blanching has been observed. It is critical the clinician does not touch the tip of the needle to the cotton tip applicator. Some technique suggestions for palatal anesthesia. The gate control theory suggests a two-stage technique may be helpful for pain management. One option would be pressure anesthesia for 1 minute following topical application for 1 minute. The clinician should maintain pressure until initial needle penetration and initial blanching. Once that has occurred, the clinician may flip the Q-tip around and support the syringe. A second option would be the pre-puncture technique. The bevel of the needle is pressed on the tissue at 45 degrees and a small amount of local anesthetic is deposited. A third option is considered the drop technique. The bevel of the needle is inserted below the tissue to 1 to 2 millimeters. A single aspiration is given and 1 to 2 drops is administered. The clinician would then wait 1 to 2 minutes before going back to administer the full dose of the anesthetic injection. Extended verbals for the nasopalatine nerve block. The medical history has been reviewed and there are no changes. The vital signs are within normal limits. There are no contraindications for local anesthesia. I will be utilizing 20% benzocaine topical for 1 to 2 minutes. 3% mepivacaine plain local anesthetic with an expiration date of January 2019. I will also be utilizing a 27 gauge short needle. This injection is the nasopalatine nerve block. It anesthetizes no teeth, only the soft tissue of the anterior one-third of the palate, approximately from canine to canine. The insertion site is at the widest portion of the incisive papilla. The depth of penetration is 2 to 4 millimeters. The deposit site is approximately the center of the incisive canal. The landmarks include the incisive papilla at the widest portion, lateral to and at the base or the posterior one-third of the incisive papilla. The pathway is 45 degrees to the opposite wall of the incisive canal. The dose range is equal to or less than 0.2 milliliters. Complications include edema, pain at the site, and possibly ischemia. It is suggested to avoid dilutions of 1 to 50,000 for this reason. Communication during the injection to both patients and faculty is important. The patient should hear positive feedback. The faculty should hear, "You have reached your landmark," when you are aspirating twice and the results. And also, you should indicate when you are ready to deposit your solution. As with all palatal injections, blanching is a positive physical sign.